Hello and welcome to the Ask Nurse Linda webinar for June. It's always lovely to be here with you. It's very interesting to me that I went to the Abilities Expo this past weekend, which was in Chicago. The Abilities Expo travels around the country, and so you get to see a lot of things from different organizations, a lot of products, just a lot of interesting things that are going on. I mean, everything from like available wheelchairs to different seating things to equipment to get up and down the steps, just all kinds of things. There's a booth about legal assistance. There's the Christopher and Dana Reeve booth is of course there. And I get to go there on Saturday. I do a presentation. So if you get to go to any of them, come look for me because I'll be looking for you. But anyway, it was very interesting being there because of all the things that were going on. But let me stop for just a moment and describe myself to you because I always forget to do that. I'm working very hard on recalling that I wrote it on a piece of paper and still I ignored it. So I'm a mature female with brown hair. I have on a black shirt today, and I wear some lightly pink rimmed glasses, which I need for seeing up close, not for, so much for distance, but it works well when I'm on the computer, so I wear them. But anyway, at the Abilities Expo, um, there were some new things that were there at the Reeve booth, one of which was this newly released book for children who either have a spinal cord injury or have um, or have a parent who has a spinal cord injury. And it's very simply written. It talks about all different kinds of things. You can get it off the website, but it has beautiful pictures. It talks about, if you are in a chair or if your parent is in a chair. So there are all kinds of things that it's just very nice for kids to see. And that's just hot off the presses. So I was really impressed with this book. It's presented by the Christopher and Dana Reeve Foundation, and it was in conjunction with the International Center for Spinal Cord Injury at the Kennedy Krieger Institute. So that's in Baltimore. So that's a lovely facility as well, and we have friends that are there as well too. Another book that I noticed that a lot of people were taking, and I found it interesting because so many people were taking it, but one of the booklets was a booklet about if you're a victim of a crime and what to do and how that whole process works. And a lot of people were taking that. I was surprised at the number of people who reached so quickly for that book. And it wasn't because they had been a victim of a crime, but just because of the way that life is. Sometimes for people with disabilities, they're a little more vulnerable to crimes. And so it's a good idea if you download that now and just become familiar with, how the process works, what's going on, because if you should be unfortunate, and I hope it never happens, I would love it if no one would ever need that book. But if something does happen and you do become a victim of a crime, it's good to know that you have this resource and that'll kind of walk you through, what you need to do and all these sort of things. So it's an unfortunate thing to have, but it's a good piece of information to just be familiar with those things. Also, I've noticed a change in the Abilities Expos, a small little tweak and change in that we always have a lot of people on the webinar. People write to me because they need funding for equipment or they need funding for home modifications, or, there's so much that's needed that you just never, um, insurance doesn't cover it or your payer doesn't cover it. And there's so many things that would be so beneficial to your life that's difficult to get a hold of. And so I noticed just a very small little change at the Abilities Expo. I met someone from the Terry's Legacy. I've talked about them before. They're in Pennsylvania. They do one county in Pennsylvania with home remodeling for people. So this was a new thing that has just come up really since the COVID time. There used to be a lot more foundations before the COVID that helped people with supplemental kinds of things. And then COVID came and that kind of all went away, but they're starting to pop up again. And there was a man I met who's looking at starting a foundation in the New York area. His name's Dan from New York. And so it was nice meeting him because he was trying to get information about, home adaptions, and he wanted to start a foundation to help people with that. So that's up and coming. And then there was another group there that had like a modular room that they would put on an existing home that was an accessible room with an accessible bathroom. So it would kind of give you your own space with accessibility in that space if you couldn't like get to the bathroom in your house, if you couldn't get up and down the steps to your house, but it attached to your house. So once you were in your room, you could move into the different parts of your house. So anyway, that was kind of cool. And so it's always neat to go to that Abilities Expo and see what's new. Now, sometimes, it can be a little disheartening because you think, oh, wow, here's the perfect bed for me, or here's the perfect wheelchair. They always have the accessible vans there, which are all new and shiny and they all look great. It's like going to a new car lot and everything looks so great. And then you come home and well, how am I going to afford this? And that's always a huge problem. But if you know what's out there, it can be very helpful to kind of help you plan for the future, set those goals. So it's kind of neat to see that kind of thing. It's not always big, huge things like a new room for your house or a new van, but there's a lot of different equipment that's available for bladder programs, a lot of adaptive equipment that's more simple kinds of things. So anything new, there's always a lot of clothing, adaptable clothing at those abilities expos too. So they're just kind of neat and fun to go and see what's what, and you can get a lot of information. Well, we're going to start with the questions. And I noticed today we very rarely have questions about skincare, but I noticed today we have several of them. So I'm going to start right off the bat with that because there's really two parts to skincare. One is the part of preventing any kind of pressure injury, any kind of wound, rashes, friction injury. Uh, any kind of anything that disrupts the skin, because the skin is a living organ of our body and it actually protects our whole insides as a barrier. It keeps viruses out of us. It keeps um, bacteria away from us. It protects us. It keeps what's inside of us healthy, and it wards off any kind of trouble. But we have to be careful and with our skin, no matter who we are, we have to be protective of our skin because we have more solar rays in our atmosphere than we have had in the past. We have to be careful, all of us, when we go outside to wear a skin protectant if we're going to be outside for any length of time. And then you also want to protect your eyes. So the incidence of macular degeneration seems to be raising in our population. And a lot of it is, well, it's due to a lot of things, but some of it is due to the sun hitting our eyes and us squinting because the sun is so bright. So always, when you go outside, be sure and wear your wide brim hat to keep the solar rays off your head and the back of your neck, and cover yourself as much as you can. And then also wear sunglasses with the solar protectant in them. Now that you can go out and get really cute sunglasses for $1 or $2, but you want to pop for maybe the $10 pair that will have a little tag on here that has the UVA, UVB protection, because sunglasses that are just plastic sunglasses, they're not going to protect your eyes. So you want to be very cautious when you buy those kind of things. But you want to take care of your skin, keep it clean. If you get any kind of injury on your skin, if you get a little cut or a bump or bruise, you want to watch and make sure that that heals up nicely. And then you also want to do, if you have paralysis and you don't have sensation, you want to protect your skin by doing your wheelchair push-ups. So pushing up on the side of your chair and holding your body up for a number of seconds, maybe even 20 to 30 seconds, so that the little capillaries inside your skin can refill with fluid. People who have sensation will move and twitch around and move and toss and turn at night. and they're constantly moving. We don't realize it because some of the movements are so small that we don't even think anything about it. We just, readjust ourselves and move on. But when you have paralysis, you may have problems with sensation and you're not adjusting yourself as much. So, especially in the areas where bones stick close out to the skin. So, one right away you can think of is your elbow, and your elbow's right there. And if I were to sit here and just hold my head up with my elbow and just put that on the table here, it would only be like a minute or two, and I would get a red spot because I'm a lightly pigmented person. I would get a red spot on my elbow. Now, when that became uncomfortable, I would move it, and that circulation would start back up again. But if you don't have sensation, or if your sensation is diminished a little bit, you might not know that that's happening. So you have to be sure and move your body where you do have sensation, you want to move, and your body where you have less sensation, you want to move. So you might tilt yourself side to side, but be careful when you're doing this because it's real easy because of proprioception problems. It's really easy that you could tilt forward and tilt yourself right out of the wheelchair. So be sure and have somebody monitoring you while you're doing that until you become comfortable and knowing what that's all about, doing your wheelchair push-ups. If you are not able to do those things, if you have a caregiver who can help do those pressure releases for you by lifting your body. Now, that would be a big job because you need to do these about every 10 minutes or so. So, if you're having somebody lift you every 10 minutes, you wouldn't be doing much of anything else. But most people who have more higher level paralysis have a wheelchair with a tilt function, and that will serve as your pressure release. So you can tilt yourself way back, which changes the pressure on your sitting bones or on your tailbone. Those are the most common places where people get pressure injuries. You can also get pressure injuries down your vertebrae of your spine. People who are laying in bed on their back with their head on a pillow sometimes will get a pressure injury at the base of the skull back here. I don't know if you can see me on the camera, on the back of my head or on the top of the head here, because pillows um, do not disperse pressure. So sometimes people, maybe they've had a stroke or a brain injury, and they need some kind of pressure dispersing equipment. Sometimes they'll use a pillow to prop their arm, or they'll sit on a pillow. Pillows collapse and create pressure. So if you're sitting on a pillow or you're using a pillow for pressure dispersing, it's not dispersing, it's making more pressure. So beware of that. You always want to use medical grade equipment. Now, I've seen people go to the craft store and they think, oh, I use a foam cushion in my wheelchair and I'd like a new one. That's so much cheaper at the craft store. It also does not disperse equipment. Only the medical grade foam is built differently. Foam is made out of a bunch of little cells compressed together to make the foam. And so the way that the foam is made in medical grade, those little cells don't just collapse like in craft foam. So sometimes I see people with craft foam. You do not use that. It has to be medical grade equipment to help protect your skin, and then it disperses the pressure areas throughout your body. Now we do have a skincare book, and I see Donna, thank you very much, has already put up the link to the skincare information. So all of this information is in those skincare books about different ways to relieve your pressure. Now, when you do your range of motion exercises, and a lot of people will think, oh yeah, I did that in rehab and I did it when I first got home, and I was just so bored with it. And it's kind of hard to lift your leg if it doesn't have any movement or have somebody else do it for you. But these things are all important because it stirs up your circulation. It gets that circulation going. So it's very important to keep up with that as far as your skin goes. You want to keep your skin clean. If you've had an accident, maybe you've had an incontinency of urine or stool, you want to make sure that that gets cleaned up right away because that is caustic material. And so it kind of burns your skin a little bit and can create infection and maybe a fungus, a rash, and it can help break down your skin. Now, you do want to pay attention to what we call in the hospital the peri area, the groin and the fold in the bottom. And you do want to make sure and wash that every day because, there's the children's book, The Gas We Pass, and everybody passes gas. And so that area around your rectum can be rather moist because you're releasing gas there. Hopefully, your bowel program has got the stool controlled, but gas gets passed. So you do want to make sure that that's kind of a caustic substance on you. Or if you're wearing like an external catheter so that you keep your penis clean and let it air out one time a day so that, it doesn't have that constant wet moisture or the if you have a self-sticking catheter, so you get some of that sticky stuff off of your skin. So these are all just important little things. Part of your skin is your nails. So make sure that you have your nails. It's always recommended clip straight across because that gives you less chance for an ingrown nail, especially in the toes. Make sure your feet are in shoes that don't curl up your toes that will cause infections around the toenails. And then I was going somewhere else with this, but I lost my thought, so it'll come to me later. Finally, the other thing to think about is you're managing your skin because you don't want to have that pressure injury. So pressure injury comes on so quickly and so subtly. So you need to check your skin every day. You're the owner of the body you're in. So you need to know what's going on in with your skin. Now, nobody can look around and see their rear on their own. So you have to use a mirror, or maybe your caregiver's checking for you. Be sure you have a mirror so what they see, you want to see because you're the owner of that skin. So make sure that you have a good idea of what's going on with your skin. If you see a change in pigment in your skin, as I mentioned, I'm lightly pigmented. So in my skin, I would have a pink change over a bony prominence. And in that skincare book, there's a picture of where every bony prominence is in the body. And so sometimes people forget if they lay on their stomach that your hip bones can get pressure injury or your knees can get pressure injury. Or if you're very thin, sometimes people up on their sternum or on their breastbone will get a pressure injury. So you need to be careful of all these areas. And that book really outlines everything about where you can get a pressure injury. Sometimes people wear equipment where there's a strap that goes across maybe like the top of their shin under their knee. And so that's really not a place where we think of a pressure injury is happening, but it can happen there because your shin bone might be rubbing up against that strap that's holding the leg brace on. And so you need to check those areas and check them frequently to make sure that you're not getting any pigment changes. Now, also, people who have darkly pigmented skin, the pressure area may look different. The pressure area may be more purplish. Sometimes people will get like what they call ashy. It might look kind of white, like there's a white coating or something over the darkly pigmented skin, especially if it's over one of those bony prominences where the bones are close to the surface of the skin. That's especially when you want to stay off of that area and let it heal up because we want to keep the pressure injury from fully developing because that can turn into, a much more difficult problem. So if you get a pressure injury, you have a change in pigment, you want to stay off that area until that change in pigment goes away. When the pigment goes back to your natural skin tone, and you ready to maybe sit up again or you're ready to lay on that side again or wherever the pressure injury is, you need to rebuild your skin tolerance. So if you've been off that area and you haven't sat in your wheelchair for a couple of weeks, you're going to need to start over with building up your skin tolerance. Because if you put a lot of pressure on it, say you get back in your wheelchair and you're in your wheelchair for 12 hours, that pigment area is going to come right back. So you have to take this time to go back. It'll be worth your time in the long run because once you have a pressure injury, that skin becomes a scar. And scars do not have the elasticity. Like, look at my skin has a lot of stretch to it. I can pull up quite a little chunk off the back of my hand. And it has elasticity because when you move over a joint, your skin's able to stretch while that being pulled across that joint, and yet it shrinks back a little bit when it's going back to the original to uh, the opposite way of pulling that particular joint. So you just need to be mindful that your skin is elastic, but scars are not. So then once you have that scar from a pressure injury, that area will always be more prone to more pressure injury. So now here's an interesting question. Why do some people do everything to prevent pressure injury and yet they get one? Other people seemingly don't do so much and they never get one. So why is that? It probably has something to do with that autonomic nervous system, that part of your nervous system that regulates your body without your conscious mind thinking about it. So, like your heart beating, your uh, your digestive system working, um, all those, your liver working, all those, your kidneys working, all those kind of things that happen automatically in your body. When people have neurological injury from trauma or disease, it doesn't matter from which, the autonomic nervous system can be affected. Some more so, some people less so. Who has it more so and who has it less so, we don't really know. Now, interestingly, there is a test that you can do to test your autonomic nervous system, but you will not have that test because it is a test that can become life threatening. And so people don't administer this test unless there's some like really far out reason to do it. But we know that people have more frequent infections, people that have more frequent skin breakdown, they probably have more trouble with their autonomic nervous system than somebody who doesn't. Aging is another factor. I have people write to me all the time. I never had a pressure injury, and now I've hit age 60, and oh my gosh, I'm starting to have these red spots all the time over areas. Our skin does change over time. So you need to protect that skin, you need to watch, you need to get in good habits of doing those pressure releases and watching that. So let's turn to some of these specific questions. And one is a person had a deep pressure injury for almost 2 years. Pressure mapping, now that is a cool thing. It's a pad that you lay or sit on for just a temporary part of time, and over it lays on top of your pressure dispersing equipment. Then you either sit or lay on it, and there's like a heat sensor, and the computer outline will show out. Red, it means there's too much pressure in this area. Yellow means there's not hardly any pressure, and it has variants of that. So they had mapping, and they finds out they're not receiving pressure from their wheelchair like they thought, but rather from the bed, which they've restricted themselves to because they were having pressure, which he thought was the right thing. He's now sitting in his chair, but he has limited help in the night and cannot turn on his side very much. What's the best air loss mattress you can recommend? Well, I can't recommend any air loss mattress for you because I don't know you and I don't know your skin, but I can tell you that you've got your pressure mapping done. So your therapist will be able to prescribe a mattress that will reduce the pressure. And they can do pressure mattresses, trying on different models or types of mattresses, overlays, or mattresses themselves, so that they will find the right one for you. So a lot of people ask me, which is the right wheelchair cushion for me? Which is the best one? Which is the one that I need? And I don't know which one you need. If you are a heavier person, you need a more sturdy mattress that is more protective if you're a heavier person, because fat collapses like a pillow. It causes more pressure. The same if you're a very, very thin person and your muscles are thinner over those bony prominences, a good juicy muscles, what really helps protect that. But that's hard to maintain when you have paralysis. So if you're overweight or you're underweight, you probably need a higher protection kind of piece of equipment. So the equipment comes basically, it will come out with medical grade foam, is usually a lower level piece of equipment. Then you have some that are like medical grade foam with some air in there. You have some air cushions that are um, all air. You have some that are flat surface or some that are molded to the body shape. You have some that have like a memory foam in there. You have some that have like little prongs that you sit on, like a whole cushion full of these little like finger-like prongs that have air in them. And then your bony prominence kind of finds its way in between those prongs. So the prongs kind of support around the bony prominence, but the bony prominence isn't getting direct pressure on that exact bony prominence. So those are very helpful. You have some that even for the wheelchair or for the bed that alternate pressure where the air moves around. So that's kind of doing your skin shifts for you, which might be something that this questioner might be interested in, where it's constantly changing pressures like in 4 quadrants of the bed. So that helps a little bit with those pressure shifts. If you can't and you don't have help at night and you're trying to change to roll yourself and you need somebody to help roll you and you can't do it yourself, you can maybe get an overhead bed trapeze or different pieces of equipment that might help. Some beds actually do a shifting and a rotation so that you're constantly being rocked and cradled all night. So that, the number of pieces of equipment are phenomenal that are out there. So there is something for everyone, but you just need to get that. You've had this pressure mapping done, and so you've got the evidence that you need a different type of equipment for your bed. So that is good that you've done the legwork, because if you've got proof with that pressure mapping that you need a different piece of equipment. And so that's very, very important that you've got that done. So you should be able to move ahead with your therapist on that. Here's a person who has questions about dysplasia and bed sores, so problems with their hip and bed sores. And so sometimes when the hip's out of alignment, you might have a pressure area in your body where that bone is not in the place where you would normally think it would be. So you just need to accommodate that. And again, you might want to get the pressure mapping done to find out where your pressure area is, which is unique to you, so that you can get the correct piece of equipment, because we don't want pressure injury on anyone. Now, there is no piece of pressure equipment that can eliminate your risk of pressure injury. I hate to say it, but I say it all the time because it's true. But it can certainly help reduce your risk. You still have to do pressure releases, you still have to turn, you still have to do all those things. So be sure and check, because with dysplasia, you can be getting pressure injury from sitting in your wheelchair, maybe with the arm being too close and the side of your legs rubbing up against the arm of your wheelchair. So be sure and go to your doctor, get pressure mapping, find out what your pressure is, and then they're gonna be able to help treat with that. There's a question just says nerve pain, and we talk a lot about nerve pain. We have information that Donna will put up in the chat box over there. There is a hierarchy for treating nerve pain. If you have nerve pain, that's a treatment for like a muscle ache, like over-the-counter medications, probably not going to help you. Opioids do not help nerve pain. There are only certain medications that help nerve pain. There are two specifically devised for nerve pain, Neurontin and Lyrica. And so they're the big guns for nerve pain. You have to titrate on them and you have to titrate off of them. So you have to start on a low amount and you have to build up over time till your pain is tolerated. If you go off of it, you have to titrate off of it. If you go cold turkey and go off of it, you will go through withdrawals, and remarkably, your pain will be much harder to treat with any other kind of medication. If you don't want to go with the gabapentin or the pregabalin, the Neurontin or the Lyrica, some people will take medications at a very low dose for seizures or at a very low dose for depression. Now, these medications at this low dose will not treat seizures or will not treat depression. But what they found with people who have paralysis and they had depression, were being treated for depression or for seizures or epilepsy, they very rarely get neuropathic pain because a side effect of that medication is it affects neuropathic pain. So you can take lower doses of those medications, and some people like that because it's taking less medicine. So some people like to start with that to get their pain under control. Now, any of these medications, you cannot take like a little bit of this and a little bit of that, and maybe one of those over there. You can only take one of these at any one time, and they all have to be titrated up till your pain is controlled, and then they all have to be weaned off. So if one is not working for you, you have to go completely off that medication before you can start the new medication. They don't work together. They don't play nicely in your body. So you cannot do that. Here's a person that's recovering from their third flap from sitting in a motorized wheelchair, and they're looking for the best wheelchair cushion to prevent further damage to their tailbone. Now, some people do have a tailbone that protrudes. They're maybe very thin. And so some people need a little extra work around their tailbone area. And there are cushions that have a little cutout just in the back where your tailbone goes. So there's nothing underneath your tailbone, but the rest of your buttocks and your upper thighs are being supported. So your body weight's being supported, your rectal area is being supported, because you don't want the weight of your whole body being pressed down through the rectal area like when you're sitting on the commode. So you want to spend as little time there as possible. And then but they have this little cutout for the tailbone in particular. So you'll be looking for something like that. Again, somebody's looking for a good bed mattress, or maybe ones that should be avoided. The ones that should be avoided are your regular standard mattresses. You need to have a bed overlay, or you need to have a special pressure dispersing mattress in its entirety. And don't forget the back of your head. If you don't have head control, if you can't pick up your head and turn it and move it around, you need to have a pressure dispersing pillow under your head as well. If you have your arm that's in an arm tray that you're using on your wheelchair, be sure it has pressure dispersing equipment on that arm trough. Um, if you need things special for your feet, there are moon boots, or these boots that you can put on your feet at night to help protect your heels. So there's all different kinds of things that you can do. Here's somebody who wrote in and says, life after suffering paralysis has been a blur, and I need to have a better outlook if possible. I think we can all relate to that if we've had a spinal cord injury or any kind of paralysis from a stroke or brain injury, or if you're a caregiver of one. It is hard to adapt to this. So trying to develop a better outlook requires, I think, personally, getting used to your routine, because your routine can be so overpowering. Oh, now I have to do a push-up. Oh, wait a minute. Now I have to go do my back work. Oh, wait a minute. Now I have to catheterize. Write down your routine. Look at what you're doing. Look at how long it takes you to do it. And then know what I'm going to go to the bathroom. I'm going to catheterize. It's going to take 10 minutes. Okay, I know that. And so once you take power over those things, you can start to integrate, this is the way I do it, and I have to move forward with that. It's great to be able to talk to somebody professionally who can help you kind of walk through some of these things. Because I know I myself, sometimes I have a task that I have to do, and I have to go do this. And I have done that where I've timed myself and think, wow, that didn't really take so long at all. Well, this isn't such a bad thing to do. But in my mind's eye, I had built it to, oh, I have to do this all day long. So, you have to help kind of get yourself in proportion to what's going on. Now, I know this is oversimplifying, and 3 minutes in a webinar is certainly not going to solve the problem. But just trying to find somebody to help. You can talk to somebody who's maybe a religious person. You can talk to a counselor. If you can find somebody who has experience working with people who deal with spinal cord injury, it's very helpful, because they'll know a little bit more about what you're going through and what you're talking about. The Reeve Foundation has this wonderful peer mentoring program. I've met a lot of the peer mentors, and they are just really fabulous people. they're specially educated to be able to help you with your problems. So you don't have to worry about getting with a peer mentor and you find yourself helping the peer mentor. So if you get a peer mentor, be sure and go to some place like the Reeve Foundation or some organization that has some kind of training and monitoring of the peer mentors, because the idea is that the peer mentor is being successful in their life. And not that they don't have any problems, because everybody does, but they're being successful in their life and they want to help you be successful in yours. And that is a great place to get started. They try to match you up with somebody in your area, somebody who has similar family constellation. They try to put men with men and women with women because they each have different issues. So there's all kinds of things. They'll get to know you in the screening process and they'll match you up with somebody. And if it doesn't work out, you can just call and say, this isn't working out. Could I try someone else? So it's not like, okay, that's what I'm locked into for the rest of my life. So those are all important things to know. There's another question that I just love this, because this person writes in and says, I need a source for good bandages to wrap my legs. 25 years ago, I had two from the rehab that lasted over 10 years, but the bandages nowadays are not the same. They don't last. Oh, I read this and you just made me like, yes, I know all about this. Because working in the hospital, now this would be back, I'm going to say like in the 1990s. This is a long time ago. And hospitals were trying to figure out ways to consolidate funds. And so they looked at the population in the hospital and they found the average length of stay in the hospital is 3.5 days. So why were they spending so much money on these good, heavy, thick ACE wrap bandages? I said a product name, sorry. But these really heavy ACE wrap bandages, why were we? Because they're only going to be there 3.5 days. So they started getting these real cheap ones, and they were just horrible. Now, when you work like me on rehab, people are there a lot more than 3.5 days. But in 3.5 days, those other ones would be stretched out. We could no longer get the really good thick ones that would last. So it will be hard. They're still out there, but you really have to search the internet. I wish I had a site that I could just tell you, but they're still out there, the heavy duty ACE wrap bandages. And maybe you need to look up heavy duty ACE wrap bandages, because I know exactly what you're talking about. Those little flimsy ones, they last 3.5 days. That's how long they are built to last, and that is how long they last. So you can still find them. What you might want to switch to is some of the compression stockings. They are a little more uniform in applying pressure from toe to knee or toe to thigh, depending on how high you need to get them. They can be a challenge to get on because, they fit tight and so they're hard to get on somebody. They do come in stockings that have zippers on the side of them. Now, be cautious with that. If you have a lot of fluid collection in the zippers, are those nylon ones, they're not metal or anything. But if you have a lot of fluid in your legs, those zippers can kind of, when you're zipping or unzipping them, they can kind of get caught if you have a hairy leg, or if you have a lot of fluid in there, they can kind of get caught a little bit in the skin and they can tear your skin. So be cautious with that. It's something to think about. You'll have to decide with your healthcare professional if they're more expensive, of course. And the ones I see, they look great. I've seen people use them and they're fabulous. And then I've had a few people use them that wasn't right for them. It's like anything. Every product, some are right for you and some are not right for you. So that would be an issue. Some people don't like using the compression stockings. And just because they're difficult, they're warm, but the ACE wraps are warm and they're kind of hard to get evenly wrapped around your leg and correctly wrap around the leg. So they have to go, whenever you put a wrap on a body, an ACE wrap on the body, you go from the point furthest away from the heart up to the heart. So you start from the toes and go up the leg. If you have one on your hand, you start from the fingers and go up the arm. So you have to be very careful with that. but probably you'll want to switch to those Ted hose. You can get them in artistic colors and all kinds of things. They come in different weights for how much compression you need. So you probably want to get a pair that is prescribed. And once you find out what the compression value is that you need, you can probably get some of those fancier, colorful ones online, as long as you know what the compression factor is that you need for your leg, because they do come in different compression levels. So there's some more questions in the chat box. So let's go there and see what's going on here. So what's the best way to work hard to recover bowel and bladder function? So I'm thinking you have some sort of paralysis, and everybody would love to do this. So they're wanting to know, is it pelvic floor physio acupuncture with stim in the pelvic floor or something else? So they have lots of problem with pain from cathing. You know, there is a lubricant that has an anesthetic in it that you can use. So you might want to switch to that lubricant. Which it's very helpful. And so anyway, they're having trouble with this catheter, which I assume is the reason why they want to really work hard and return to bowel and bladder function. So it depends on what your level is. If you do not have a neurological injury, then pelvic floor exercises are wonderful. If you have a partial injury, or if you have a brain injury where you still have some urinary function, then you can do the pelvic floor exercises. Now, there's electrical stimulation that will cause your body to do pelvic floor exercises, and it will strengthen the muscles in the pelvic floor, but it's not going to do anything with contraction of the bladder. So, and you need that contraction of the bladder to help get the urine out, and you need to have the sphincter that will open in coordination with the bladder. So the first thing you might want to do is to get urodynamic testing, if you haven't done that, to make sure all the body parts are working. The last thing you want to do is do a treatment like increasing the muscles in your pelvic floor, so then the urine can't overcome that, strengthen those muscles now to push the urine out. So you need to, first of all, get a really good evaluation of what's going on. Now, I hope after 16 urologists, you've seen somebody who's done urodynamic testing, so you'll know exactly what you're working with. The other thing is what's for some people, trying these new external FES stimulations, that's just a strip that goes on the lower back if you're looking for bowel and bladder control. Some people are learning to do that. If you have a spinal cord injury and there's a misconnection or brain injury where the messages are not being interpreted correctly, it's going to be a challenge to retrain you, because messages aren't going to be getting back to, back and forth from the brain and the bladder, and all that has to occur to be independent in that. So some people are doing these FES electrical stimulations. You can have a stimulator put up on the higher part of your back in the thoracic area and get more hand function. You can do it down on the lower back and have more bowel, bladder, and sexual function. After injury, it won't be the same as it was before, but it can have some improvement. Now, if you have a lower level injury in the cauda equina or in the sacral roots, there's some surgeries that neurosurgeons can perform to move some nerves around to help improve bowel and bladder function. There are some implants that you can get that is an electrical stimulator that's implanted in the abdomen with a little tube that goes around to the lower spine that will help stimulate those S2 through S4 nerves that controls bowel, bladder, and sexual function. And then what you do when you have to toilet, you go in and you press a button, and it opens one press opens the urethra and urine will come out. Two presses opens the bowel. And so, they're all configured, different brands are configured different ways, but there are devices that you can have implanted. Now, some of those devices are for people who have urinary incontinence. not spinal cord injury. So you have to talk to somebody who's going to put if you choose that route, to put the right device in. So there are a lot of options. Now, if you have a higher spinal cord injury, some of these devices are not going to be working for you, but that external FES will certainly help. But the simplest thing I think is to try the um, lubricant with the anesthesia in it, and that would, I would think, be a first stop. And so anyway, they're looking for, some people do use full-time catheters for their bladder control, and that was one of the questions here about permanent use. Some people get a mitral fan off procedure, which is a little surgical procedure where they make an opening in the belly button. Imagine this. They'll take a piece of bowel or a piece or the appendix, and they'll make a track from the inside of the belly button to the top of the bladder. And then you catheterize by putting the catheter in through the belly button and draining urine. You don't need to have the catheter in at all times because the that little tract is there, so urine doesn't come spilling out. And then, of course, one of the last resorts is some people will elect to have an ileostomy, which is making an opening so that you wear a little bag and urine just comes out through that little bag. But now that's pretty dramatic. There's so many more options before you get to that high level of treatment. So I hope that gives you some ideas about what you might want to do with that. And then, oh, this is the same question again. Um, they were told by their doctor that if it's under 600 cc's, it's okay to sleep through the night and won't mess up the elasticity of the bladder in the future, or maybe they have real control. What's your thoughts on this? Well, that is a huge amount. I don't know what your situation is. If you've had a bladder augmentation to make your bladder hold more, that is a huge amount. Now, if your bladder's safe and it's not going to back up into your kidneys, but we usually say for women like 350 and men for 400. You as an individual, there might be something different about you. So I can't really, if your doctor told you that that was okay for you, then you have to do, or you decide between you and your healthcare professional. Like I say, I don't know you, I don't know about your health history, so I can only tell you what the normals are, but everybody has something different going on in their body. So that's another thing. Talking about elasticity of the bladder, if you do elect to have an indwelling catheter in 24/7, your bladder muscle will shrink down. Now, if you elect later on to have other treatments, there are ways that you can restretch your bladder muscle. So, but there can be complications with having the bladder shrink down because when urine is not in there at all, it doesn't have to stretch to store it. So there are different ways of restretching that bladder, but there's so many different options here that there's no need to just jump right through on that. Um, So sleep is important, and yes, absolutely, it's important to everyone. And people don't like to get up at that nighttime catheterization. What we usually tell people to do is to catheterize to go to bed about an hour ahead of time. So say you go to bed at 10 o'clock and then at 11 o'clock catheterize. And then sometimes you can sleep until 3 or 4 the next morning, have all the supplies at your bedside, just do it at your bedside, get up and clean up the catheter supplies in the morning, just have a waste paper basket and do that. So it's nice when we can get people 6 hours of sleep when they're doing intermittent catheterization. Not everybody can do that, and we would know that by your urodynamic testing and your volume. So, if you're going with those high volumes, that's a pretty high uh, volume on that. Um, so yeah, so the next question is about being able to ejaculate. And yes, after a spinal cord injury, um, sex won't is not the same as it was before. And so people are looking for that huge orgasm. It's probably not going to be that way. It might be a little tingling, it might be a warm feeling, it might be something that is so much less intense, but still you have the satisfaction and the release. And so you can, you kind of have that internal body stimulation, but you just have to learn to recognize that, and you have to learn to work with that. A lot of people will take cues from their partner, and when they're having an orgasm and use that. Some people will do sex differently. Some people don't do the penis to vagina sex. Some people will use their upper arm and in their armpit and have the penis go through there if they have a sensation in their armpit but not in their vagina. Those kinds of things are very helpful. So there's all different kinds of ways, and we have a booklet on sexual function that should really help with coming up with different ways. The body is stimulated sexually in different ways. So some people will find, like the ears are very stimulating, and pulling on the ear or kissing on the ears very arousing, and they'll have a different kind of response with that kind of thing. uh, Certainly the regular places on the body that are sexually stimulated, but also if you happen to have a scar from your injury. That scar tissue is very fragile, but it can be very sensitive, and sometimes rubbing that scar can help with sexual arousal. So there's all kinds of things that you can do to help. And I see the booklet is up there, so I really recommend that you get that. To get that. The next question is about catheters, and yeah, insurance pays for what insurance pays for. Now you can go around that um, with different needs. If you get a letter of medical necessity from your healthcare provider, you can ask them if they will write a letter of medical necessity. The answer that comes back will be no. Okay, then there's a way to appeal. Have your healthcare provider appeal and keep going until they say this is the hard no. If it's something because of your convenience that you would like to have, they're probably not going to do it. But if there's something medically necessary that you need a different kind of thing, so that if you said you're having a hard time with gloves, then maybe a touchless catheter so you can be independent. Those kind of things will get it. If you just say, yeah, I don't like doing that way, that's not gonna fly. um let's see. Oh, I was wondering how to stop nerve pain, and we've been talking about that. And be sure and look at the pain book, because there are medicines that we went over, but also look at that pain book, because there are other things that you can do. You can do biofeedback. People do distraction, moving your body in a slow and gentle manner. If you move like this, it's going to hurt more. But if you move your body very slow, or have somebody move your body very slowly, that helps reduce some of the pain, because the muscles inside your body are seeking movement. They're always wanting to move. That's the way the body functions. So when you're not getting that message to move, the muscles are saying, "What's going on?" The muscles transmit a message to the nerve. The nerve can't take it to the brain because of the injury, either in the brain or in the spinal cord. And so it says, I don't know what to do with this message, so I'm just going to yell, and this nerve is yelling inside your body. Sometimes if you have pain in one particular area, you can get some capsaicin, you can get some Botox injections, you can put lidocaine ointment on that area, and that will help reduce the pain. So there's a lot of tips and time savers in that booklet. So who can do pressure mapping? It's done by a therapist, either the physical therapist or the occupational therapist. Most major rehabilitation centers have pressure mapping. Some do not. You might have to ask your physician, where can I go to get pressure mapping? It might not be your regular place, but they can write a pressure order. They can write a pressure order. They can write doctor's order for you to go and have pressure mapping done, and then you can take that prescription to any place that you can find one. If you can't find some place, You can call, look up pressure mapping near me. You can call a company who does pressure mapping and ask if they've sold any equipment to any of the hospitals around locally. So there's a variety of ways that you can locate those places, but your doctor should know one. And they might not, you might live in an area where there's just not a lot of pressure mapping done for one reason or another. But you can scout it down and find them out. Oh, not much plays nicely in my body anymore. I know it's really challenging when things are just like, seems like it can be one difficulty after another. And so that can be a challenge. Back to the person with the nerve pain, he says he's on the Lyrica, the maximum dose. Actually, Lyrica doesn't have a maximum dose. You can go overdose, not an overdose, but you can go over the limit very cautiously. If Lyrica is not doing for it for you, you might have to go off the Lyrica and maybe gabapentin will. It's very odd the way these pain medications work. They usually work for most people, but every once in a while, we have a person like this person who's written in, and every once in a while, they're on the they're on the Lyrica, it's not working, and so they switch to the Neurontin and it works. Funny thing about neuropathic pain, and I wish I had more information about this, but it doesn't exist. Sometimes when people change from one pain medication to another, you have to go completely off the pain medication. So you're at a time point where you're on no pain medication before you can go on to the new one. Sometimes when people go off, they find they don't have neuropathic pain anymore. It's the craziest thing. And I wish I had more information about it. I wish I could tell you, oh, you need to be on the pain medicine for this long, and then your pain will go away. It's different for everyone. And for some people, it never goes away. And for some people, it does. We don't know why, but we're trying to figure out these things. So when traveling, can I temporarily sleep on a regular mattress? I hate to say yes, I hate to say no. The answer is no. You have to take the equipment with you, or you have to have a portable pressure dispersing mattress to take with you, one of the eggshells or one of the overlays that you can take with you. And the reason is because a regular mattress is hard and there's no pressure dispersing in that at all. And so you can develop a pressure injury in 10 or 15 minutes by laying on that mattress. But I know traveling is difficult with all your equipment, but those are some of the things that you have to take with you. Oh, can you get a pressure dispersing topper for a regular mattress? Yes, you can. They can be they can be air, they can be medical grade foam, they can be gel. I don't think I mentioned the gel foam, the gel cushions. So there's all different kinds. So whatever is similar to your regular pressure dispersing, you can get a order for that so that you can get that. Um, it's a question about the, I think you're talking about the Pirouette catheters. They're the ones that insert into the vagina for women. And then they have a one for men now as well. They don't have vaginas, but it's something that you can use. Now, the problem with using those, they say they're for people with spinal cord injury, and I've tried to contact them because if you have a bladder that's going to expel urine, so if you have a spastic bladder that's going to expel urine, and you know that's happening, and you've had testing and you know that it's working that way, that would make sense. A lot of times people are having overflow after they have spinal cord, and that's the urine that's coming out, but the bladder's just growing bigger and bigger. So I have not yet figured out how those work for neurogenic bladders. So I'm hesitant on saying anything about that kind of thing. Oh, the stretching treatments. So what are the stretching treatments? It's a range of motion where you go through every joint in the body and move every single joint. And there's a booklet that's posted here in our webinar chat about how to do those and what to do. So it's very important to provide that muscle input so the muscles can contact their nerve that's controlling them and saying we're getting movement. And so it kind of calms down everything that's going on. Um, and then the scar tissue for my injury is extremely painful to touch. Is that normal? It's not abnormal. Scar tissue is very sensitive. And so, if you don't want to use that as a sexual stimulant, if it's painful, because that's going to miss the point there. But sometimes that scar tissue is very painful. There's tape that you can put on your scar. It's called scar tape. So it's not very tricky, and it will help reduce some of that sensitivity. Now, you might not want it all to go away if you're going to use your scar for sexual stimulation, but you want it to not be painful. There's also a scar cream that you can put on there that kind of helps reduce that. And those are the names of them. They come under different brands, but those are the names. Female external collection systems, there's been a variety of those that have come out. And so far, except for that PureWick one that's being advertised for neurogenic bladder, but again, I don't have the information on that. And I've called, I've checked, but that what they give me does not satisfy me as a rehabilitation nurse. So I need to find out more about that. There's been other external collection systems, but they have not really fared very well. So for the female, there's just not a lot of options there. But people are coming up with things all the time. Now I can see we're at the hour, so it's time for me to sign off. But somebody says they have a lot of questions. And remember, anybody who has questions, you go to the Reeve Foundation website. There's a blue button there. It says Ask Nurse Linda. You can type in any questions and it comes directly to me. It's private, it's personal between you and me, and I will answer your question to the best of my ability. So I'll look forward to some questions in my Ask Nurse Linda box. So thank you so much for coming. One note I want to make is July 10th, we're having a webinar about neural restoration, neural recovery. It's going to be terrific. Leaders, it's in what we call the professional webinar, but everyone's invited. And it's all about what's going on in science about recovery of the nervous system. So please tune in. It'll be the 10th. It's at 2 o'clock Central Time, and I'll look forward to seeing you there. Thanks so much.